Hi, my name is Cindy Salazar, and my topic of presentation is gestational diabetes. So, what is gestational diabetes? We might have heard that term before. So, gestational diabetes is a condition caused by high levels of glucose in the blood during pregnancy, and is one of the most common medical conditions during pregnancy. The approximate number of pregnant women who develop gestational diabetes is between 2 and 20%. Um, there are many factors influencing the development of gestational diabetes. They range from physiological, they range from ethnic predisposition, from lifestyle, from dietary. For example, an overweight woman gets pregnant. She lives a sedentary lifestyle with poor diet. She will have a higher chance of developing gestational diabetes than someone who lives an active lifestyle and who has a moderate healthy lifestyle, healthy diet. Um, Gestational diabetes does not only affect the mother, but it affects the baby, and it's linked to various medical complications. Therefore, it is very important to intervene early on the pregnancy to ensure safe care of mother and baby. Um, so you might ask yourself, who is at risk of developing gestational diabetes? So the high risk group includes, but is not limited to, women who are 25 years old and older, who are pregnant with multiples, who have a history of type 2 diabetes in her immediate family, her BMI is greater than 25, and she belongs to certain ethnic groups. Um, for example, in Manitoba, there was a study that revealed First Nation women have 3 times higher chances of developing gestational diabetes than those non First Nations. Um, there are many serious complications um, of having gestational diabetes. This includes preeclampsia and preterm delivery. It also complicates things for baby because excessive fetal growth can cause stillbirth. It is recommended that women who are in the high risk groups, who are diagnosed with gestational diabetes, are also screened for type 2 diabetes after birth and before planning another pregnancy. Let's move on to Corrida's praxis. Um, Corrida's praxis will allow me to be authentically present for my patient to help her achieve a healthy lifestyle. I will be present and supportive of my patient's feelings, um, and that will help develop a therapeutic relationship. Um, the Coritas factors that I will use and process that I will use will be expressing positive and negative feelings. I will allow my patient to express positive or negative feelings without judgment. Um, I will allow her to unfold and share her concerns and thoughts about her disease, and this will help with acceptance. I will also authenticate her feelings, which are much valid, and advise and address her concerns. Um, I will be promoting interpersonal teaching. I will promote teaching and learning, and I will tailor her care plan according to her own learning needs. The nursing act the nursing acts that I will apply to this is teach. I will be teaching the patient about risk and complications and giving her information of treatments just for her. Um, I will provide I will provide her with information pertaining to the management of the disease and the how to of everything. And I will support her by always listening to any concerns and acknowledge and validating her feelings. In regards to family centered care, oftentimes women want to be in control of everything, especially in regarding her pregnancy. So when she unexpectedly receives this kind of news, she needs a support of steering her care and have some control over it. Um, Incorporating the client in the developing of her own care plan will enhance her experience all the way through to the delivery. Um, Her wishes will be respected and encouraged. When addressing her lifestyle changes and possible treatments, she will have full control of the situation. Now, you may ask yourself, how is gestational diabetes diagnosed? There are several tools: the O'Sullivan test, the urinary glucose test, the oral glucose test, and the capillary blood glucose test. With that being said, the most common one is the oral glucose tolerance test, or the OGTT. For this test, the client have to fast for 8 hours before she gets her blood drawn. The first time she gets it drawn will be for a baseline um, data. Then she will have her blood drawn again for the next 2 to 3 hours. Um, Interventions, there are many forms of interventions, from pharmaceutical, from non-pharmaceutical, but the most common one and the one that I would choose is the lifestyle and dietary change. That way you don't have to go to the pharmaceutical way right away. You can, if this doesn't work, you have something to fall on. So for dietary, the intervention, um, the dietary and lifestyle change, along with constant monitoring of her capillary um, blood glucose levels. Uh, how do you know that this intervention, that diet and the lifestyle intervention was successful? So to finalize on this presentation, what have I learned about doing this research? I've learned that when you're working with a patient, uh, it's not a one size fits all. So you have to lean on and research evidence based practices. You have to have a credible research. And as a student nurse, I will make sure will educate my my clients, my patients, and the complications and this about this disease, and how something so easy can help you. Um, Changes, small changes can help you in the long run. and with gestational diabetes, sometimes just, the dietary and the lifestyle change will improve your health so much. So that's one thing that I'm taking with me. And sometimes it's about small changes and small steps. So thank you, and I hope you like my presentation.